All right. So let's just go ahead and get started. So, ladies and gentlemen, peace. And I want to give my greetings to you guys. Tonight is going to be a very special video. Now, I know some of you are sitting back watching the debate going on and whatnot with the two so-called, one is so-called president, the other one is the vice president. I don't know. So, yeah, I wouldn't even call it a debate at this point. I would call it a roasting contest. So, yeah, so I know that you guys are watching. However, I decided to do this video tonight to pay tribute to one of the elders who in our community was a psychiatrist based in Baltimore, Maryland. But she has done many lectures, okay? And she has done many works, and she has worked with people like Dr. Anthony Browder, Dr. Francis Chris Welsling, whoever you can name, she had worked with them. So, however, she has made her transition. She passed away today. So, yes, she passed away. The cause of her death, I do not know. I just found out. So the person that I'm talking about, who we're going to be honoring, is Dr. Patricia Newton. Excuse me, Dr. Patricia Newton. So Dr. Patricia Newton has passed away today, and yeah, it's pretty sad. It was unexpected for a lot of people. So, and the reason why I'm doing it because she happened to be one the few that I used to watch all the time. Because as you guys know, that I like sociology. So when I was going to school, I was going to school to study sociology. And some years ago, right, I came across her video on YouTube and I was watching her ever since then. So I used to watch her and Dr. Francis Quest Welsling and Dr. Joy DeGruy. Um, yeah. So she has been one of my biggest inspiration. And for her to make a transition that's really, yeah, it's really heartbreaking. So, but anyways, we're gonna look at some information and then we're gonna look at a video. Now, if you want to watch the video, cool. If not, then you can catch up on it later. So yes, I'm gonna look at some of the information that I came across, and I found some few of her works, articles that she has done regarding to African American males, and her psychiatry work, because remember, she's a psychiatrist, or she was a psychiatrist, so that was her lane, that was her field. So I have some information on that, and with that being said, let's go ahead and get started. All right. So as you can see, this is Dr. Patricia Newton. Yep, she was the sister that passed away. All right. So let's look at some of the works that she has done thus so far. Okay. So I don't have much information about her biography, but I do have some information that's regarding to her field and the work that as far as her work as a psychiatrist and articles that she had written and things like that. So I'll show you guys. All right. There we go, right there. Okay, bingo. So as you can see, this is one of the papers that she wrote. It's called "The Role of the Federal Government in Mental Health." Okay. Now it's written by Patricia A. Newton, Baltimore, Maryland, because she was based in Baltimore. All right. And it's called, and this was written in 1982. It's in the Journal of the National Medical Association, volume 74. All right, it says this paper will report a survey of public opinion regarding the role of the federal government in mental health. The impact of cuts in federal funding for mental health care is analyzed and discussed. All right, so to read some of the information she has done, all right, this is her research. It says of the mentally ill in this country is a sad contradiction when compared with the general status of healthcare in the United States. For many years, these persons were considered unfit to live with decent, normal people and were forced to endure public ridicule and ostracism. Okay, they were locked away in asylum and virtually ignored. Over the past 40 years, however, remarkable strides have been made in psychiatry. The invent of major tranquilizer in the 1950s virtually unlocked the doors, allowing many of these patients to return to their homes and society. More recently, biological research has begun to reveal links between behavior and brain chemistry. Neural treatment and diagnostic methods, including antidepressant, blood level measurement, and CT scans, based on these neurochemical theories, have evolved and made it possible for affected persons to receive treatment in outpatient setting while maintaining their jobs, family, relation, and general life patterns. Okay. And it says virtually all of research and training that has brought about these changes has been fairly funded through grants and slash or contract. Large groups of people, poor minorities, elderly, and children for whom it had been impossible to receive reasonable psychiatric care are now being treated at some of the best hospitals and clinics in the country. This being due largely to federally sponsored Medicare and Medicaid program and the event of community mental health clinics in the 1960s. All right, so again, this is one of her research paper that she did. Okay. It says in the past 20 years, the momentum in research and treatment concept have shown great strides. Concurrently, there have been staggering inflation rates and rising medical costs that are mind-boggling. These have resulted in the mental hospitals and community mental health centers. Thousands of mental patients have been thrown into the streets or frequently out of the medical care system and into the penal system. Coupled with this has been the decreasing number of physicians specializing in psychiatry, as well as an increase in the number of existing psychiatrists leaving the public sector for private practice. All right. And so here it is, the tables, right? Okay, they show the age groups of those who are part of the research, men, women, etc. Okay. So remember, she was a psychiatrist. All right, and that's what they do. So And it says for the public in general, in particular, the poor, and more recently, the middle class, there has been a decrease in the accessibility of resources for the management of emotional difficulties, with one out of every four families have firsthand experience of a relative requiring psychiatric care of some kind. It becomes obvious that this is an immense problem and one that is growing every day. What then should be the federal government's role with respect to mental health care given present physical constraints? All right, and then goes down, talk about the methods and results and discussion. All right, so again, this is one her research paper right here. I'm not gonna read all into it, but just to give you an idea of what she was doing. Yes, I'm good. I'm good. Thank you. Thank you. I appreciate that. Yeah, so that's Dr. Patricia Newton work right there. That was one of her works. What she was focusing on the federal government aids for those who have suffered mental illness and getting psychiatric helps and things like that within the Baltimore area. So again, that's where she was at in Baltimore, Maryland. That's where she was licensed to do her practice. And so she was focusing on those within the Baltimore area and how many people who develop mental illness and how they're not really getting the proper help or receiving help from the federal government, etc. So that's one of her papers. Let's look at the other one. Oh, shoot. All right. Now this paper right here, if you can see it. Okay. Yeah. Cool. All right. So this paper right here is dealing with the evaluation of African American males who are schizophrenic. All right. So it's called an evaluation of the cost effectiveness of day hospitalization for Black male schizophrenics. All right. And it was written by Patricia A. Newton, Baltimore, Maryland. And this is another of her studies that she done. And this was done in 1983 at the Journal of the National Medical Association. All right. And it says, because of persistent inflation and the policies of the Reagan administration regarding the use of federal dollars for mental health services, coupled with the closing of many state mental hospital beds and large numbers of deinstitutionalized psychiatric patient returning to community life, the question arises as to how the mental health system can adequately meet this increasing demand. This is of particular concern to community-based general hospitals, public and private, and community mental health centers that provide service to large numbers of poor, elderly, and minority population group. In an era in which the very effectiveness of mental health care is being increasingly questioned, it is important for those of us who provide such care to continue to examine alternatives to traditional inpatient treatment. Now it goes on to say, although the feasibility of day hospital treatment was first described in Soviet Union by I'm not going to try to pronounce that person's name, so I'm assuming that name is Russian. But anyways, continue. The extent of this feasibility was not known until the 1960s when Zorlin and Wilder demonstrated that 2/3 of all referrals for psychiatric hospitalization could function in a day hospital setting. Enthusiasts such as Mendel even suggest that inpatient mental health hospital structure might be done away with altogether. On the other hand, Hoggetry and the group of the Advancement of Psychiatry Committee on Therapeutic Care warned of the adverse effects to patient and families when a spectrum of coordinated alternatives to inpatient treatments were not actually available to the seriously ill. Mm, wow. These diverse claims call for systematic comparison of outcomes of patient exposed to inpatient and day settings. Now, unfortunately, although a few comparative studies do exist, their methodologies, patient population, and findings are diverse. The result of these studies may be summarized first in terms of treatment effectiveness, as reflected by change in psychopathology and social adjustment, and second, in terms of treatment costs, as measured directly by patient charges and indirectly by length of hospitalization and community tenure. All right, so and it's a lot she wrote right here. And it says, in terms of treatment or effectiveness, when patient otherwise destined for inpatient treatment have been randomized to a day hospital setting, they have fared as well or better than inpatient. Short-term result for overall outcomes seem to favor the randomized day hospital patient. With the increasing passage of time, however, there is some evidence that the differential effects of day hospitalization tend to disappear. Regarding specific psychiatric symptomology are more inconsistent. Okay, hers etc., found a great decrease in psychopathology for day hospital patients. In contrast, in a non randomized comparison of inpatient and day treatment effects, Michael reported that at least during their period of attachment to the inpatient facility, inpatient experienced greater symptomatic relief than did day hospital patients. It says with time, however, advantage found in either setting again tend to disappear. In a comparison between patients receiving day hospital care only, with matched controls receiving inpatient treatment only, let's see, Lockerball found no significant differences at discharge and on follow-up at 1 year in terms of condition between two groups. When a comparison was made between patients using a day hospital for aftercare with those using inpatient treatment, one author found that the only difference in clinical outcome at 1 year follow-up tended to favor the day hospital transfers, particularly inpatient self-ratings. However, these differences were slight. An interesting variable upon which patients were not matched in this study, but which did make a difference in 1 year outcome, was inpatient hospitalization prior to the study admission, the first 4 and more days in the hospital in the experimental group, irrespective of the treatment group to which the patient was assigned during the episode of illness. Under studies, patients have previous hospitalization incurred greater costs. All right. So again, that comes from her studies and her works. Um, so yes, so she was evaluating the causes, right? That for patients, particularly African American males who have schizophrenic, and how much it costs for them to go and receive psychiatric care um, and things of that nature. So that was the primary focus during that time period, and this was the time when Ronald Reagan was president. Man, yeah. But I want to say something real quick before I get started with the video. So let me say something real quick about mental illness. All right. Anyone that's dealing with a certain type of illness, especially something like schizophrenic, a lot of times they may not get the proper treatment or the proper help that is needed, like medical attention or whatever. And as I was reading in the article, the previous article, where there were many mental institution that was closed down. That happens a lot. Okay. That happens where, as a matter of fact, it happened where I'm at. There was a mental institution downtown, and they closed that one down. So all the people that has all these mental illness, they put them on the street. And while they're on the street, everything else is built. See, this is how the government do it. So the government is basically saying that we would not fund any money towards these institutions. We'll rather just put these people on the streets and let them focus. Yeah, just like the homeless shelters. All right. Some of the homeless shelters has been closed down as well because the government could discontinue to put money into these facilities, right? So their thing is, well, we'd just rather let the homeless people just be out there in the street and just roam the streets. So you got a case of those who are at disadvantage and they can't get any help. So when you look out here, you'll see a combination, not just homeless people, but those who are suffering from mental illness. And most of the time, many of them are veterans, military veterans at that. So I'm just speaking on that because with this article, it does apply to what's going on today, even though that article was written in the 80s. All right. So let's go ahead and get. Oh, I thought I heard something. Let's go ahead and get started with the video. Okay. So I'm not gonna. So if you want to watch it, you can watch it. If you don't, then it's cool. I understand. It's on you. Okay. All right. Hold on. Let me try this again. Let me try that again. All right. Share the audio. All right. There we go. There we go. Okay. Bingo. Okay.
Hotel.
Abanagari, Nangadef, Wahuntasan. Our languages. Word up, y'all. First of all, let me say I'm both honored and humbled to be here to talk about something that is near and dear to my heart and has been for many, many years. I'm sorry that it's on the heels of an event that had to be brought to national attention where people have been traumatized and now people are trying to sensationalize it. I'm just back. I have a little bit of a, bug. I'm just back from 3 continents. I was in South Africa, and Monday I just returned from Cuba and Jamaica. So I'm jet lagging, and Thursday I'm leaving for Egypt. So you'll have to pardon me if I start coughing in between this presentation. I thought we were going to have an overhead projector. So as those of you who know me know, I always come with a whole bunch of slides and a whole bunch of information. And unfortunately, we don't have that overhead projector. So I'm going to just talk from the heart, and maybe that's even better, you know? And I'm going to take some of these slides out and deal with them as I go along. The whole issue of early sexual trauma in African American people is an issue that is long overdue in terms of our discussion. The fact that there are no or few community leaders here, minimal amount of clergy here, so-called here does not surprise me. It is typical of the reaction formation of a traumatized people. And we are a traumatized people. Some of you know that I have a book called Post Traumatic Slavery Disorder, but before that book was started, the book that was in progress was called Early Sexual Trauma in Black Men. I stopped writing that book to start dealing with the post-traumatic slavery issue. And now, as God would have it, I guess I have to start that book back up again. I'm reminded of a phrase from a movie called One Flew Over the Cuckoo's Nest that says, they work in you in ways you cannot fight. They keep on and on until you're fixed. So the question is, are we fixed? And if so, how did we get fixed? Virginia Woolf said in her statement in the movie, in a discussion about sex, she says, and any question about sex is that one cannot hope that anyone will ever tell the truth. Now, the reality is, in telling the truth about what is happening to our people, is that the African American community are a people under siege. We are and we have been at war for a very long time, and we have been in denial, which is what traumatized people do. The first thing they do is go into shock, and then they deny what the heck is happening to them. And in our systems, I want to say straight up that the failure to protect our children from sexual predators, both heterosexual, homosexual, and sometimes unclear sexual, is a public health problem of magnitude proportions that has gone unrecognized, unfunded, and unreciprocated in terms of what is right for our people. It is prevailing and it is pervasive in every aspect of Black people's lives. It is in our churches, it is in our schools, it is in our families, it is in every place that we live and breathe and sleep and eat and sing and dance and in Baltimore City, many years ago, and I'll get to that data. When I first came to Baltimore, I came as initially worked at Shepherd Pratt to get a master's in public health at Johns Hopkins. Little did I know what I was getting myself into. I never intended to stay here. I intended to zip in, get my stuff, and book. It's been 24 years, and here I am. But Baltimore has been an interesting place for me because for a person in behavior who studies behavior and who does that for a living, it is a, what can I say, plethora of examples and research ideologies. I was amazed when we first started looking at when Providence Hospital was still in existence. You all do remember that place. I hope some of you who are old enough. We started looking at first-time admissions to the emergency room, regardless of their diagnosis. And I'll get into that in a minute. But what was amazing to me is because all of my training had been in Europeanized institutions. Although I came from a very African-centered family who walked with King in all the old days, who had cross burns in front of our house. I remember Daisy Bates and Martin Luther King and these people sitting at the table with my family, having dinner and things. So I came from at that time, a conscious family. So it was not semi-comatoseness that I had experienced. But I had never experienced an environment that was predominantly Black, predominantly African, where there were Black people everywhere doing everything. Other than a handful of people, I had never seen more than 5 Black doctors in my life. I had never seen more than 3 African American nurses in my life. I had never seen a Black judge. And so when I came to Baltimore, I thought I was in seventh heaven. I didn't realize I was in eighth hell. Because the reality was, it was a beautiful facade. A facade well. We were really shucking and jiving because there was a lack of consciousness and that I had never experienced coming out of the South. And Baltimore's the South, y'all. It was, you know, although it tries to
Hey, you guys, I'm sorry about that. The video just cut out due to the service, so I'm gonna play the video back. Give me a second, you guys. Okay, so I'm going ahead and play the video.
was a beautiful facade. A facade that would lead you to think that we were doing extremely well. And we were really shucking and jiving. Because there was a lack of consciousness and commitment among Black people in this city for each other that I had never experienced coming out of the South. It was the South, y'all. It was, you know, although it tries to pretend that it's a northern and east coast city, it is not. And so I was alarmed at the fact that Europeans in Baltimore City had more in common with the Black people than I did. That really bothered me, that I didn't seem to identify and relate to my colleagues who were spending their time getting high. I'm talking about physicians now, swapping wives, doing all manner of perverted things, and couldn't understand why I didn't want to be a part of that. Then I became the chairperson of the Department of Psychiatry at Providence. The first thing that I noticed was the need that Black people have for each other to make sure they get something negative and derogatory and perversive on a person so they can control them in this time. Well, apparently I didn't do too well in that because I didn't play the game. But I remember being invited to in Providence. And I came with, you know, braids and African clothes then, and they didn't know what to do with that because that was 20 some years ago. You know, like, who is that and where did she come from? And my God. And what is she made of? Is she funny? Is she relationship with my husband who lived in New York and I lived here? So, you know, it was basically none of their business. But anyway, so I got invited to a party. And I figured, well, this is my staff giving a party. So what do? You go. The first thing that hit me was a young man at the door who said, "Hi, I'd like to have you for breakfast." And I looked at him and said, "Do you want scrambled or poached eggs?" And then I said, "This is no place for me. I'm out of here." Well, we can't get it that way. So another and I went to the bathroom when I came from the bathroom, and this woman met me at the door and wanted to know that I want to play. And I said, "Play what? With who? And for what? And where?" And she said, I said, "Let me tell you something, sweetie. Last time I checked, where I'm looking at, you have no penis. And where I come from as a woman, if you don't have a penis, I can use you." So I left that part. So it got to the point that there was no place within the medical community, I'm being straight up, that you could go where you felt safe. And then couple that with all of these people who were coming in the emergency rooms with various diagnoses, none of which were sexual in nature, except maybe some violent acting out between people who were fighting over love spats, etc., etc. But one thing that began to bother me is that as we began to analyze the data with people, 7 out of every 10 men and 8.2 out of every 10 women have reported being sexually traumatized at one time in their life. This is in Baltimore City, Providence Hospital emergency room. And so you told I'm talking about black people. And I'm like, what is going on here? How in the world does that many people have been sexually traumatized? I don't even believe that. I believe these people lying to me. But then as time went on, and we began to look at various diagnoses and things, and many of these patients had become psychiatric cases. They had depressions, or they had schizophrenias, or they were suicidal, or they were alcoholic, or they were drug abusers, and nobody wanted to deal with them. So it got to the point that I stopped asking people if they had been molested and began to ask them, when were you molested? And in Baltimore City, 8.7 out of every 10 people have had some kind of sexual molestation encounter. This is very, very sad. This is not normal. But if you were to look at a statistical curve, you would say that sexual abuse or incest or rape or sexual traumatic experiences is the normative behavior for Baltimore City based upon the statistics. You extrapolate that out to other African American communities and you find out that it's not so rare. But what you do find is that in a place this size, this small, quote, quote, large, that it tends to be the normative experience for a child in this town to have had early sexual trauma, and it is abnormal for them to have gone through to adulthood and not have been molested in Baltimore City. Now that's sad, and nobody talks about it. It's a conspiracy of silence, and we talk about sex in the church. I have this slide because I wanted to show this for a second. This came from Newsweek magazine in 1993. 1993. Well, they were talking about priests and child abuse. We act like this just happened. This is not just happening. And what is a problem for us is that we as a religious and spiritual people, our lives and our social context are centered around church and school activities. That is where we focus our being because that has been the nature and fabric of our institutions that have been able to sustain themselves through the period of both slavery and segregation, Jim Crowism, and now the new modern terrorism. attached, where people are losing their liberties all over again. But in the process of that, you and I know, if we're honest with each other, that the Black church, the Black school, and the Black civic institutions have been teeming with sexual predators for years. For years. And we have turned a deaf ear. In lieu of some favors sometimes from the clergy, some money that was thrown our way for some kind of community center, some money that greased our pockets, we have ignored the reality that we have violated one of the first tenets of universal law in the failure to protect our children. You see, whatever you do as an adult, and whatever your sexual orientation is as an adult, no matter how you got there, is your business. But when you abuse children, it's all of our business. That's right. That's right. And I don't care how good and upstanding and upright a citizen you have been in the community, you have failed in the context of ethical moral law when you have violated the God image of a child, period. And so it seems to me quite ironic that many of the experiences of African American children, male and female, have come from sexual predators who have resided within major institutions, the church, the school, and the family. Yes, that's right. Because the people who are abusers generally are known to children. It's only rarely that you get grabbed off the street and sodomized in some bathroom. That's right. That's very rare. The data supports, and I had the statistics, I'll get to them in a minute. The data supports that most people who have been sexually abused and molested are molested by neighbors, friends, relatives, or significant others in their lives. And you ask yourself, well, yeah, but you know, this kind of thing's been going on since the beginning of time. Bullshit. Let me just be straight up. Bullshit. That's right. That's right. Because we got to talk about history, because most of the people doing this talking don't even know their history. That's right. That's right. They don't have stories about their history. In ancient Kemet, which I'm going on Thursday, and I wish some of you were going with me. Still time. There was an edict to keep the Greco-Roman people, the Ptolemies, out of the priesthood for over 400 years because the ancient Egyptians, Canaanites, not Arabs of today, did not understand some of the sexual practices that came from Europe. They did not understand them, and so until they could figure out where to place them, they decided to keep them out. Now, what am I saying? I'm saying that in terms of a historical reality, I don't care what you do as an adult, that's your right. But in terms of a historical reality, same-sex relationships and abuse of children were not part of the culture of antiquity prior to the second intermediary period of ancient Egypt. Now, what am I talking about? In dynasty, pre-dynastic periods, in dynasty 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12, the age of the Great Pyramids, the age of the great building of the great Ptolemaic Sphinx, the age of the earliest writings of the Book of Coming Forth by Day and by Night, which is a transitional book, or the Book of the Dead, incorrectly called, which later evolved into the Torah, into the Christian Bible, and then into the Quran. You did not hear in the mythology anything about abusing children, abusing women, or same sex relationships. Now, here's the issue. The Egyptian culture or ancient Kemetic culture was a culture that wrote everything. So if the record was going to be there, it would be there because they wrote everything. And when we look at the stories of the fables and the myths, one of the things that we find is that there has been a change in the stories. There's a book called Early Practices of Ancient Sexual Practices of Ancient Egypt, written by a European woman. And in it, she talks about bestiality or having sex with animals, and she talks about um, same sex as well as different sex relationships, etc., etc. Now, let me go and be real clear for you. Whenever somebody else starts to tell you about your history, unfortunately, since you don't know enough about it and don't really want to know, you need to ask them, could you please tell me what period of time in Egypt you're talking about? That's the basic question. Because if they tell you anything starting with the 17th, 18th, 19th dynasty and on, you are not talking about a pure African culture anymore. You're talking about a mixed culture, a culture that has infusions of Mesopotamians and Europeans and Asiatics. It is not pure black. Are y'all following me so far? I'm going to take all of my time because this is very important. That's right. So then, you see that in a culture of people before writing, in early civilizations that are organized, when you're looking at anthropologists are looking at data, they look at the terracotta, which are the the clay, pottery, etc. They look at the petroglyphs, the writings that occur on the caves. They listen to the oral story.
Okay, you guys. So that was the video of the late Dr. Patricia Newton. She was basically going into details about the early sexual trauma, which she was talking about abuse, sexual abuse, molestation during childhood, and how it affects children from throughout their lives until especially when they get into adulthood. So these things do really follow us and really does take a toll over an individual as far as how they perceive life and how they interact with the world and whatnot. So, and it makes people feel some kind of way and question the trust of other people around them. So yeah, she was one of the great psychiatrists of all time. I say one of the greatest, especially by her being a black woman. And next to her was Dr. Frances Quest Welsing. She was another one. She was another great woman that really touched on a lot of points. So, yep, that's the story of Dr. Patricia Newton. May she rest in peace. May the spirit of the ancestors be with her. And I hope you guys have a wonderful night. So if you guys watching the debate, please do the knowledge. Sit back and just, analyze all that BS that's going on right now. But anyways, I will touch back with you guys later about the debate and my thoughts on it. So I may look at it some more. I don't know. But if I do look at it, then I'll do a video about it. All right. Until then, y'all take it easy and peace. And that's all. All right. Mm-hmm.